Hi everyone, it's Mario Maroni here. Again we are with Tatiana. So Tatiana, after the session in which I treat the foot and a scar on the arm, she was feeling amazing for a couple of weeks. The pain returned mainly on the back, yeah?
Yes.
Okay, on the very bottom of the back. She said, I feel like one of my vertebrae is a little bit it moved forward.
Yeah,
forward. Today I checked, and I usually check on the same way for everyone. Let's show it. I was here, I already looked at the foot. I will show you the foot. It's not the foot, but the foot represents when you have a leg that is straight like that, there is a restriction on there is a mobility restriction. Let's say on the hip area. I'm like that, and what do I feel? I feel something on the skull, which doesn't tell me there is an injury here. When I was around this area, basically this part, I feel something that moved toward the midline. So imagine a midline here. There is something that moves toward the midline like this, okay? And then I asked, take a deep breath, and the things expand. So it tells me there is no injury there, but the skull reproduces the movement of the pelvis. So I already know there is a problem on the middle to upper part of the sacrum, left side. So what does it mean? That this is the sacrum, this is the left side. Around here, something is compressing. And then I ask, what did you have there? Did you have any operation on the area? And she has other scar. She has a scar. I will show you. There is a picture that I will show you. There are a couple of scars that she had from a previous operation on the thigh. The scar, more or less, are around this area. And in fact, if I do test there, I didn't know at the beginning, if I do test there, look at this. So one, okay? You probably can tell from the shape. I will do a close-up. I think it's quite important. Look at the pelvis, how look more straight. And here is more rounded, more natural, okay? Also, the foot, this is the very interesting things. You see the difference? The left one is completely straight, okay? This one looks more relaxed. This one looks more stuck, okay? This one is more stuck in external rotation. And this one is more natural. Yeah, this one goes away way more easily. So I already know when I touch this area here and I couple this area with this innervation, which is lumbosacral around this area here, I feel a compression. In fact, she showed me there is two scars that you see in the picture. Again, the pelvis is completely different. This side is a lot more heavy, and this side is way lighter, okay? This one will have an impact here, so there is more light here. Ooh, wow. This side is very, very, very heavy. Okay, now let's be quick. I already checked. It literally took me, was quite easy. It literally took me 5 minutes, something like 5 minutes to realize what's going on today. Okay. It's important to have an image on the leg, on the foot as well, because I hope the foot, if one is more straight, yeah? So the foot needs to release at some point, needs to hold the leg. So I was treating here, I didn't know anything about that, but definitely this injury was more important than this one. That's a massive injury. Now that injury is not there anymore, but there is some trouble on the pelvis. And she, how old are this injury, this scar?
3-4 years.
3-4 years.
I feel pumping in my head, you know? The blood started pumping in my head.
When?
Last time, now.
Now?
Here. Last time was the same feeling. We started treatment and I started to have like blood pumping in my head.
Okay, so she has this feeling, she has some
Sensation.
she feels some sensation about blood flow in her head, and we will see. Deep breath. Again. I still don't think which is completely done, but the leg released. The leg release is a little bit more relaxed.
I felt some clicking somewhere.
Yeah, the clicky was here and here.
And this.
You felt as well? Okay, that's good. On the shin, do you have a scar on the shin? No. Yeah. What is that from?
Same surgeon.
Take a deep breath. Okay, the leg released. Okay, so there was something on here. You feel it's more, but now it's never ending with you.
I know.
Okay.
I'm sorry.
Now I didn't know about this scar here either. Let me have a check.
Which one?
This one. Okay, just relax. No, you don't come here. You just stay. Oh, yeah.
My back.
Okay, don't worry about the back now. Just relax. But if your head is not straight, your pelvis is not straight. Okay, so I don't.
It's better.
You feel? It's better, but still your head is not completely in position. So I need to understand. So she has an injury, a scar here, okay, on the shin. Okay. Deep breath. Okay, I have the feeling that anyway there will be some other things to adjust because she continued to come out with scar and a lot of it. Now this part moves better. The head was a little bit dislocated. After I treated here, this part probably went a little bit like that. There was a review to do on the scar. The scar on the left is a messy one, okay? We are talking about probably 30 centimeters of scar. But she has a scar here, okay? This scar here, relax. It's not too bad. No, it's not too bad. This side was a little bit more stuck. And this one is still okay. I just want to recheck the scar. And obviously the scar, I need to... Okay, perfect. I need to feel something different. I feel something on the very top, Okay, it's the coccyx. It's the coccyx area. Let's check. Lift a little bit. Okay. Now this is the top of the sacrum. Okay? It's quite soft. And this is the coccyx. You feel how hard it is? This is the lumbar spine. The coccyx, in fact, yeah. Look. This is a feature of the coccyx only. Very, very typical of the coccyx. Now she has a black trouser. You don't see a lot, but okay. Again, why the coccyx? First, I can feel it from the head, but if you go here on the anterior, superior anterior iliac spine and you try to move the pelvis this way and that way, it is basically very, very stuck. She has a problem on the coccyx. Okay, it's clear. If I go here, relax. This is the hardest point. Okay, so the coccyx, you had a knee. You said you may have a scar on the coccyx.
Yeah.
But did you have also an operation? Or was, a fall? Or it was only the scar?
I had the fall, 2 falls, and also the operation.
So she said 2 fall, an operation. So it's a massive area of injury. That one, I hope it may be the last things. How old these days? The first fall?
Oh, when I was child.
Oh my God. Okay. Anyway, we will check the coccyx next time. For the moment, thanks for watching. Okay, I'm quite happy.
Oh my God.
I am quite happy.
It is feel better.
Feel better?
Mm-hmm.
Okay.
It was impossible. Just impossible. Now it feels completely different. It feels so much.
It's a pleasure.
Oh. And you know, here it hurts so. If I lift my legs, I have so much pain.
That's connected with the coccyx, okay?
Is it?
Yeah, the pubis and the coccyx, they are basically next, so don't worry about it.